So health information exchanges are vehicles to exchange information between organizations and between providers. That's patient-specific information seamlessly in the ideal state. So Cincinnati has had the opportunity of working with HealthBridge for many years, which is a form of a health information exchange where it is sending information between hospital organizations and between providers. The challenge with any health information exchange is data regulation and data ownership. So many HIEs have not been successful because the financial plan for making them successful and maintaining them is not always evident. So a lot of HIEs now have come up because of government funding. The challenge is going to be keeping them active and finding a financial plan to make sure that they can stay active, which means money's coming from the hospitals or from the providers instead of from grants to help fund the way that the information is maintained and exchanged. Data ownership is also a challenge too. In the Cincinnati market, HealthBridge does not own the data, it simply helps exchange the data. The data is owned by the original organizations. No one wants to create a database that continues to grow and grow and grow with every single piece of data for every single patient in a market. That's extremely expensive, and the ownership of the data then becomes problematic because everyone wants to own their own data, and you don't necessarily want every other organization to always be looking at the data and using your data. The other challenge is patient privacy and security. So the patient needs to have some role in deciding when and where their information is exchanged. So there's challenges on multiple levels with health information exchanges. The good news is that many software vendors are working to exchange information outside of the health information exchange as well. So we have a software company in Cincinnati that we work with that we use our electronic health record, and we've been able to successfully exchange information with our vendor, with other organizations that use the same vendor. I think that's a different view of health information exchange that will probably become more prominent over time as the software vendors themselves are able to exchange information seamlessly.